I love how earlier when Ingrid was up, she said, how many vans do we have here this year? And our proactive students in the front turned around and started to count, just in case there was going to be a test later. But these partners are making a big difference. The folks who are here and donating services and time and energy to help make this program a success. So let's start to acknowledge these folks and give them an opportunity to come up and speak. Let's begin with Dr. Joseph Wright, MD, Acting Chief Medical Officer of the Children's National Medical Center.
Thank you, Tracy. Let's give a big hand to these young people here who have been patiently waiting, I understand, since 7:30 this morning. Is that right? Wow. Can I get a smile from you? Congratulations. Thank you so much. My name is Joe Wright. I'm a pediatrician and have lived here in the county for more than 25 years. And I'm here to represent Children's National Medical Center as the first of the partners who will speak this morning. But I wanted to mention a few things. For 130 years, Children's National Medical Center has been a part of this community. We have had practices and specialty centers in Prince George's County for a number of years. In fact, 60% of our patients come from Maryland, and if you were to walk down the halls of our hospital, you would most likely to be able to bump into a family from Prince George's County. Our workforce predominantly from Prince George's County, so we are in the fabric of this community. I, in fact, work in the emergency department, and most of the lives that I've touched are from this county, and I'm proud of it. I'm going to talk just a moment about how this all came to be, because leadership is not just about the vision, not just about the vision of Councilmember Turner during her tenure as chair, resurrecting the Board of Health, not just the vision of the county executive bringing the chief administrative officer and bringing Betty Hager Francis, the deputy chief administrative officer, together with our new chief executive a year ago this month, to talk about what is it that we can do in this county that is our home turf at Children's National Medical Center. Well, what has occurred over the course of the last 10 months has been remarkable. It was mentioned that we started with one, and on November 9th at Seat Pleasant Elementary School, we introduced that one van. And look where we have come. Look where we have come in just 10 months. So leadership is not just about vision, it's about execution. And I really want to commend the county executive and his team for being able to make this happen. We are so proud to be a part of this, and I will just end with a real story, a sobering story. You'll hear from another of our partners, the Diamante Driver Dental Project. Well, when Diamante suffered the complications of his dental abscess, I was part of the team that took care of the complication in my role at Children's National Medical Center. It's a very sad story, obviously, but to be able to move from that reality of an unnecessary medical circumstance and complication that took the life of a young person, to be here today, and from where I sit in the emergency department, to really get out into the community and provide the kind of access that will allow for young people to have access to preventive, not only dental, but medical care. One of the things that we bring to the team here is pediatric medical care as well. So I'm so proud of it. And again, just want to commend everyone for the effort. It's really been remarkable to be a part of, and I'm looking forward to continuing. Thank you so much.
It's a stark reminder, but an important one. And it's good to see the county becoming proactive in this matter to make sure that we don't have to suffer that kind of a tragic loss again. Maria Gomez, RN, Chief Executive Officer of Mary Center for Maternal and Child Care Incorporated, is our next speaker.
Hi, how are you? It's such a pleasure to be here. I'm so delighted, and I'm going to have standing next to me really my left and right hand when it comes to the service of dental care here in Prince George's County is Dr. Gesker, Richard Gesker, so he'll talk a little bit. But I just want to say personally that can I hug you? Because not only are you a sunshine to the DMV, you're not only Prince George's, you're DMV, right? DC, Maryland, and Virginia. You have brought so much energy, you have brought so much positive, just your staff. Your staff is always smiling. I just had them on the phone, and they were like, relax, we'll get you here. So they're just beautiful, beautiful people, all of you. You have just picked the best of the best. But that's Prince George's County. They have the best of the best, and they just needed a leader. So, so thank you so much for your leadership. I want to say just that we are so proud to be here in Prince George's County. You have the most beautiful rainbow of faces in Prince George's County from all over the world, from all over this state of Maryland that have moved to Prince George's County because there are a lot of opportunities here. So thank you for that. I want to just say that Mary Center has been around for 24 years. We're celebrating our 25th year next year, and we actually are seeing about 24,000 people throughout the region. And we're very proud to have a center based in Cool Spring and the Adelphi Center. And what we long for is to continue to grow with the county, with you, to try to continue to bring resources. The March of Dimes, the United Health United Health Health Plan, as actually the donor of this van. And the March of Dimes actually got us into the business of the mobile vans. But I would want to give my voice to my colleague, the man who really makes this happen, and his staff, to say a little bit about what it means to him.
All right. Thank you, Maria. Thank you, Maria. And thank you, Mr. Baker, for your coordination efforts between all these vans. And this is a new service line for Mary Center, and it's a new outreach effort for Mary Center. But the end goal for Mary Center is not to be in the bus business, is to provide an access point for our children, into a health home, not just a dental home, not just a medical home, not just a mental health home, but a true health home. And I'm learning very quickly that the best way to provide this is to bring it a fixed facility to the community. Currently we're operating at Charles Carroll Middle School, and our response is wonderful. Our greatest challenge is getting the consent forms back from the parents via the children. Without Mr. Carey, our current principal we're operating with, we would have no consent forms returned. So without our administrators, our principals and vice principals, we would not be operational. So I would like to reach out and thank in advance our principals for wonderful cooperation.
Next we will have Debony Hughes, DDS, Program Chief of the Diamante Driver Dental Project.
Good morning, everyone. I am delighted to be here to bring you greetings from our fantastic health officer, Mrs. Pamela Creekmore, and all the hard-working men and women of the Prince George's County Health Department. We are delighted to have the Diamante Driver Dental Project involved with this innovative and collaborative mobile unit project. You all know the story, but 5 years ago, the Diamante Driver Dental Project was created after its namesake died. Diamante Driver was the little boy who died because he was unable to get an infected tooth extracted, a procedure that would have cost less than $100. From the beginning, and with the support of the Maryland Health and Mental Hygiene Department of Oral Health, this mobile dental unit has provided a needed resource to address the dearth of services in the community. Our goal is to ensure that no other child suffers due to the lack of access to dental care by bringing preventive and restorative services to the schools. Our collaborative efforts with the Colgate van will continue to ensure that the goal is met. What makes this mobile unit initiative so important? It is that our children don't have to come to us, we travel to them. And above all, we look forward to continuing to improve the lives of the most vulnerable. Thank you.
I'd like to take this time to acknowledge Councilmember Karen Tolles, who has joined us now. Councilmember Karen Tolles, if you could stand. Next, we'll welcome Marcy Borofsky, DDS, founder of Smile Programs, Smile, Maryland.
Good morning. Good morning. Thank you so much for allowing me to be here and allowing Smile Maryland to work in Prince George's County. We have been working in Prince George's County for 5 years, and are very proud of the work we've done. So I always like to use these moments. I'm a dentist, and about 15 years ago I decided, well, it's a certain time in my life to try to do something to give back and make a difference. And so I started this program, and I really want to focus on the kids when I say this. Nobody needs to suffer one cavity in their mouth. It is almost entirely preventable. But if you don't get to the dentist before it becomes a cavity, before that cavity becomes an abscess, before it becomes a pretty significant health problems that we have to, go to the medical center, and God knows what kind of pain and expense occurs. But by going to the school, by participating in dental prevention programs, and I'm going to tell you guys what this is, because we're dentists, and most of you don't like to go to the dentist. And I even some of my people here probably don't love to go. And you have no idea what we do when you open up that mouth and you pick in there and they look and they take those pictures, and you don't really know what they're looking at. So for the kids, in the pits and fissures in the back of your teeth, that's where most dental decay occurs. And if you put a sealant in that area, it is almost entirely preventable. And it's about as painless as putting nail polish on your nails, except you coat the teeth. It's a real simple procedure. The Surgeon General says this is the #1 thing you can do to prevent dental decay. And so our program really was founded to be in the schools to do these simple preventative procedures so that one day all of us will be using these beautiful facilities, mobile facilities, as classroom education, as other health education, because to this day, dental decay remains the #1 chronic infectious disease of childhood. It's worth paying attention to, and it's worth the necessary and important preventive measures that we can do on the children every day. And thank you so much. And I wanted to mention that Diamante Driver, Devaney Hughes was up here a minute ago, and she was talking in part of the Diamante Driver project, was ground zero for what's really terrible about dental access. And this day today is the day that also says that Prince George's County is #1 in terms of providing access for all children. And so thank you to the county leadership, the educational leadership, for everything you do.
Thank you, Doctor, for those wonderful reminders of what we need to do. Council Chair Andrea Harrison sends her greetings. This is her district, here District 5. She had an unforeseen meeting and was not able to join us today and regrets missing this, so she sends her greetings. So, we've learned a lot today. And for all of the kids, I know that you all have heard from a lot of folks today. You've had a lot of information come your way. What I would like for you to take away from today, the most important thing for you to remember is health care, dental care, it's important for the rest of your life. And that this county and your school cares dearly about you being a healthy student.
Brush, brushy, brush, brushy, brush, brush your teeth. Every day and every night. Now it's your parents' turn. Here's what you gotta do. Let them have your toothbrush so that they can brushy brush your teeth. Good job, you're almost done. 5, 4, 3, 2, 1. That's it. Help your teeth stay healthy. Brushy brush with a grown-up every day.
Jack Frost, you do have beautiful teeth.
My what?
Are they really as white as they say? Yes. Oh, they really do sparkle like freshly fallen snow. This is an excellent example of what teeth should look like. Check out the iridescence of that incisor, the beauty of that bicuspid, the magnificence of those molars. And the best way to achieve such terrific teeth is brushing. 2 minutes, twice a day. Not 30 seconds, not a minute 45. 2 minutes. That's all it takes. They're beautiful.